Health alert tonight. The Zika, the Zika virus now spreading explosively around the Americas. That's according to the World Health Organization. The Director General says the level of alarm is extremely high. Health leaders are working quickly to try to figure out how to stop the spread. The mosquito-borne illness now in 23 countries. The organization also says it's reasonable to estimate that there could be 3 to 4 million cases of the virus in the Americas within the next year. Channel 4's Nicole Snyder joining us live at the Florida Department of Health with an update. Nicole?
Joy, local health departments are keeping an eye on the virus, and the World Health Organization is also staying on top of the issue. Today, leaders convened to talk about the virus and what they can do. Right now, the biggest thing is that they're not sure, their uncertainty of the virus because there is no way to test it right now. It's hard to test, and also there is no treatment. The Zika virus, once considered a mild threat, is now a virus that's alarming people across the globe. World health leaders gathered to talk about the outbreaks and how it's affecting countries.
The possible links, only recently suspected, have rapidly changed the risk profile of Zika.
The main concern is the growing number of babies born with birth defects from mothers who were infected with the virus during pregnancy.
Arrival of the virus in some places has been associated with a steep increase in the birth of babies with abnormally small heads, and in cases of Guillain-Barré syndrome.
The organization is deeply concerned with the Zika virus for 4 main reasons: the possible association of infection with birth malformations and neurological syndromes, the potential for further international spread, the lack of population immunity in newly affected areas, and the absence of vaccine-specific treatment and rapid diagnostic tests. While a few cases have been identified in the U.S., no locally transmitted cases have been reported, but that could change in the future.
I think the virus, Zika virus, has the potential of becoming an epidemic in the United States.
Dr. Mobeen Rathore says 80% of people who are affected by the Zika virus don't have any symptoms, so they don't even know they have the illness. Rathore says while many doctors are seeing the link between the virus and babies with certain disorders, it still hasn't been proven.
There is not robust scientific evidence that this is a cause-effect relationship between Zika virus infection, the pregnant woman, and the baby getting small head. However, because of the epidemiological link, there's some temporal relationship, and more research is going to be done in order to make sure that if it is or it is not caused by Zika virus.
And on Monday, the World Health Organization will convene again to decide whether there will be a public health emergency. I'm live, Nicole Snyder, Channel 4, the local station.